While U.S. COVID-19 infection rates soar and the death toll tops 130,000, President Trump wants to open all the schools. How reasonable is that expectation? For that, I'm joined by Dr. Drew Pinsky, internist, addiction specialist, host of podcasts including Ask Dr. Drew and Dr. Drew After Dark. He is here in Los Angeles. Okay, what do you make of this threat? Is this a good idea to open all schools?
You know, Larry, the fact that politicians and journalists are involved in medical decision making to me is just sort of extraordinary. Um, the American Academy of Pediatrics has come out very forcefully that they want schools opened in the fall for sure. They have taken the position that withholding further socialization and education is going to have untold harm on children. And I can tell you personally, I'm not a pediatrician, but I certainly would back the American Academy of Pediatrics in their opinion. But I've been hearing constantly from parents of 18 to 15-year-olds that the level of distress, depression, anxiety, fear is so high that I'm afraid we have changed the trajectory of an entire generation by scaring them to death. That literally they believe that by going outside, they and their family will be destroyed. So of course, you tell that to an 8-year-old, they're going to concoct a fantasy where that's their reality. Going back to school would give them a sense of normalization, re-entering the educational process. I mean, we all know how important that is. So again, I don't see it as a political issue. I look to the American Academy of Pediatrics and do what they tell me.
You must hold Dr. Fauci in high respect.
I
And
do.
he has been warning us all the time. What does concern you, Drew, about this
Well, I'll
epidemic?
tell you,
What does concern
I knew we were going to have a giant uptick. I mean, that's what concerns me right now. Dr. Fauci is someone I've been looking to and been a guide for me since I was working in the AIDS epidemic back in the early '80s. And back then, he's the reason I got involved in radio. Actually, he was encouraging young physicians to go out there and educate and change behavior. We were sort of marching with the orders that if we didn't change behavior, 10 million people would die. 10 million people would die. That was the number we were chanting. Well, we ended up with 175,000 deaths. It was a tragedy that I had to bear witness to, and I will never forget. And most of the people who bore witness are not with us anymore, so we've forgotten that chapter. But I've since then been looking to Dr. Fauci for my guidance, really for all things infectious disease out of the CDC. So when he said this is not the flu, we should be concerned. The R naught is very serious. This is something to be taken very seriously. Just do what he tells you. He's conservative, but he's extremely careful in the language and how he analyzes the data and currently available wisdom. And when he gives a recommendation, he will keep us safe if we follow it. Now, if he comes out against the American Academy of Pediatrics, I would go with Fauci.
What do you make of the World Health Organization now saying that there's evidence emerging that the airborne spread can occur with this virus? What do you make of that?
Well, I don't understand why that's a headline, because we have known that for the last several months that the transmission on objects and surfaces is relatively uncommon, but this virus is transmitted person to person, and the probability of transmission is determined by proximity and duration of that proximity. End of story. I mean, that's how it's transmitted, essentially nose to nose. It's a cold virus that has been morphed to give it these virulent properties. One of the things that concerns me, Larry, you mentioned Dr. Fauci, I did not mention, is the inconsistent messaging that is coming out of public health generally. Because I've spent most of my life giving public health messages in the media, I've learned how people react to inconsistent, hypocritical, or exaggerated messages. And how would you imagine, Larry? Let's say you're hearing confusing messages, or they seem hypocritical, or they seem exaggerated. How would you react as a private citizen when they tell you what to do after giving inconsistent messaging? Well, yeah, that's right. You go, I don't know anymore. Yeah, I don't know what to do anymore. Well, unfortunately, that's what's happening. And I call it reefer madness. I call it reefer madness. I call it the reefer madness syndrome, because the first time I saw it was with cannabis, when the public health grossly overstated the risk of cannabis. Every generation since now has rejected all public health messaging around cannabis. There's been no rational conversation since that overstatement in the 1970s. Then I got involved in the HIV and AIDS epidemic, and we made it sound dramatic. And now I can't get young people to wear condoms. So here we are 30 years later, still the effect of excessive, exaggerated messaging. And now we're saying, well, you can go out and do this, but you can't do that, and you can't be in a barbecue, but you could be outside with your 30,000 of your peers. We need to make the message very clear because people will stop listening to us. And the problem is we have a squandered opportunity here. If we don't wear the masks, this is going to really spiral out of control. So if you're going to go to a barbecue or go to a demonstration or go to a public event, wear the damn mask.
But we have a president who doesn't lead us, a president who
Well,
doesn't
not with
wear
the
a mask,
mask.
a
Not with the
president who
mask. So, yep,
a president who
I agree
claimed
with you.
99% of coronavirus cases are totally harmless.
Well,
That's
that number is
ridiculous.
actually, if you look at the fatality rate of the current estimated, let me tell you two things. I wish you'd wear a mask, and the political rally in Oklahoma was me watching people get infected on live TV. That was bad. That was not okay. Those people not wearing masks made me cringe. The 99% number, if you take estimated cases, not documented cases, if you take proven cases, again, we have estimated cases, we have proven cases. If you have established cases, the fatality rate is around 4%. If you take estimated cases, it's around 1%, in which case 99% of people recover. So it depends on how you interpret your data.
What do you know about the long-term impact of being infected with this?
Well, again, the vast majority of people, you have millions of cases, get through this just fine. Again, even if we accept the fatality rate of 4%, 96% of people do fine. Now, amongst that let's take the 96% recovery rate as the highest, a reasonable number to look at. Amongst that 96%, what percentage have lingering effects? The reality is we don't know the full number there yet. We all hear anecdotal reports about people having fatigue and neuropathies and persistent pulmonary problems and shortness of breath that go on for months many times. I've been studying the 1918 influenza outbreak, and the neurobiological / psychiatric effects of that virus was profound, not just from diseases of despair, which is what we're seeing now with this virus. People are being locked down so long without losing their jobs, forced into poverty. Diseases of despair are skyrocketing, but we're also seeing what they saw in the 1918 flu, which is mood disturbances, thought disturbances, neurological disturbances that are very troubling. But that's what happens with bad viruses. That is just what happens.
What about herd immunity? How does that impact the ultimate resolution of this crisis?
Well, people argue about whether, what the number is for herd immunity and whether we could ever achieve herd immunity. I must say, I have hopes for a vaccine, but I don't have hopes for herd immunity prior to the vaccine. Personally, I feel so strongly the science around some of the newer vaccines, particularly RNA vaccines, are so exciting that I would like to be, if anybody you're connected with who's watching this can get me in a phase 3 trial, I would love to be a human subject, particularly for the RNA vaccine. I can't get the vaccine fast enough. The science looks good. They look very safe. The issue is going to be scaling up to the point where you can give it to hundreds of millions of people. That's going to be an interesting challenge.
Do you worry about flying? Commercial air. Do you worry about it?
Oh, for sure. And if I were, I suspect if I were over, for sure, if I were over 75, probably if I were the age of 70, I would not. I would not. I would take the recommendations generally to limit my activity. Now, I am planning to fly. My friends that do fly tell me the incidence of COVID amongst flight attendants and pilots is low to zero, which is very reassuring. I will wear a mask, and I will use UV wands, and I'll be doing all kinds of stuff to reduce my risk. And again, it's not just the flying, it's also what goes on in the airport and through the securities and in the cars when you leave the airport. There's lots of opportunity for exposure, so obviously high risk behavior.
What in all of this concerns you the most right now?
A couple things, Larry. What concerns me is that we're squandering an opportunity. If you look at there's a website, covid19.healthdata.org, that the University of Washington, Dr. Charles Murray puts out, and he shows in graphic format exactly what we can do with universal mask compliance, exactly how far down we can press this epidemic just by simply having a barrier over our nose and mouth between you and me. And again, optimally, not optimally, really for it to work, both people have to have the barrier. If we do that, we will get this thing under control. I was very optimistic about that. The problem is that so much of what is being reported is panic porn. Every single story I see about COVID now, I have to go look at the data myself. I have to parse out what's going on. There's a county here locally in Los Angeles that yesterday I was reporting on. They said that they were being overrun by COVID. I went back and looked at the data. They had 13% hospital, they were 96% full, but only not 13% was COVID cases. Now, to me, the real story there is that people weren't getting their medical care. They were accumulating illnesses that were getting severe, and now they're coming in. And of course, hospitals are overwhelmed. That should be our story. So what concerns me is people aren't getting their medical care. People are having diseases of despair skyrocketing. Overdoses are up. Depression is up. Suicide is up. And because of the panic in the press, this is all getting worse. So I would wish that rather than people out there reporting on these things, resist the urge to engage in panic porn and try to stay focused on, please, everybody, wear your mask, get your medical care. Diseases of despair are up. Take care of your mental health. Part of that is losing your job and being forced into poverty. So let's take care of the people that need work and need jobs and need support. Let's do those things, not freak out about numbers that fluctuate as they will.
Do you expect things would change if there's a change in the administration? If Joe Biden is president?
I'm sure things will change. I mean, the tone will change. As I told you before the break, the thing that concerns me is the heightened tone. People breathlessly with their hair on fire, running forward with every report. I feel like that would go away. I do not feel. I may be in a minority here, but I do not feel as though there should be some unifying federal policy. I think that may be a grave error because, as I said before, this is such a patchwork of local epidemiology. To have one giant behemoth plan will absolutely be appropriate for some areas and inappropriate for others. The other thing, there's a lot of focus on testing. I mean, at this point, I'm not sure what testing does for us. Let's say we could test everybody in the country today, right now, by some magic. What would we do with that information? How would we track it? And
we
guess
know
what?
more
Because
than we
these
did
tests are
before.
but be very careful. These tests are inconsistent and they change across the course of the infection. So doing at a slice of time in a given moment does not give you that much information. You'll have to do it again in 3 days, 6 days, 9 days, 12 days. You'll have to keep doing it if your end point is what you're trying to achieve is to identify everybody and their contacts. It would take not just one moment, it would take multiple moments over quite a period of time. So I'm concerned about that.
Is your answer then don't test?
No, that's not my test. My answer is test. We're doing a great job here in Los Angeles, by the way, with testing. My test symptomatic, test contacts. Do it. But the problem is we're relying on individuals to go out and do that. I think people are pretty motivated to do so.
All right, concerning this whole issue, are you more optimistic or pessimistic?
I'm depressed. I imagine that's probably, I'm depressed because I've been, we've all had our lives sort of either turned upside down or taken away from us. And the really hard part is for me, I'm used to planning ahead, seeing a future, building things down the road. I just see an empty set because it's so uncertain. I don't know what to anticipate. And I find that very depressing. I'm an eternal optimist. I believe we'll get on the other side of this, but I don't know how much suffering we're going to have to go through before we do.
Dr. Drew, you're always a great guest. Thanks for your expertise.
Thanks, Larry.